Hi, I'm GOKULKESAV. My registration number is 17BBT0200. I'm going to talk about an important environmental issue, healthcare waste. It is a byproduct of healthcare that includes sharps, non-sharp, blood contaminated items, blood, body parts, tissues, chemicals, pharmaceuticals, and radioactive materials. Of the amount of waste generated by the healthcare activities, about 85% is general, that is non-hazardous waste. The remaining 50%, 15% is considered hazardous material that may be infectious, toxic, or radioactive. Each year, an estimated 16 billion injections are administered worldwide, but not all of these needles and syringes are properly disposed of afterwards. Open burning and incineration of healthcare waste can, under some circumstances, result in the emission of dioxins, furans, and particulate matters. Measures to ensure the safe and environmentally sound management of the healthcare waste can prevent adverse health and environmental impacts from such waste, including the unintended release of chemical or biological hazards, including drug resistant microorganisms, into the environmental, thus protecting the health of patients, health workers, and general public. Types of waste. Waste and byproducts cover a diverse range of materials. First, infectious waste. These are nothing but the waste contaminated with lead and other bodily fluids. Example from discarded diagnostic samples. Cultures and stocks of infectious agents from laboratory work. Second, pathological waste. Human tissues, organs, or fluids and body parts come under the pathological waste. Third, sharp waste. These are nothing but syringes, needles, disposable scalpels, and blades, etc. Fourth, chemical waste. For example, solvents and reagents used for laboratory preparations, disinfectant, heavy metals contained in medical devices, etc. Fifth, pharmaceutical waste. Expired, unused, and contaminated drugs and vaccines come under this category. Sixth, cytotoxic waste. Waste containing substances with genotoxic properties, that is, highly hazardous substances that are mutagenic, teratogenic, or carcinogenic, such as cytotoxic drugs used in cancer treatment and their metabolites. Next, radioactive waste. These are nothing but products contaminated by radionuclides, including radioactive diagnostic material or radiotherapeutic materials. And last, non hazardous waste or general waste. These are nothing but the waste that does not pose any particular biological, chemical, radioactive, or physical hazard. There are six major sources of healthcare waste. First, hospitals and other health related facilities. Second, laboratories and research centers. Third, mortuary and autopsy centers. Fourth, animal research and testing laboratories. Fifth, blood banks and collection services. Sixth, nursing homes for the elderly. It is found by World Health Organization that high-income countries generate on average up to zero point 0.5 kgs of hazardous waste per hospital bed per day, while low-income countries generate on average of zero point 0.2 kg per day. Environmental impacts. Treatment and disposal of healthcare waste may pose health risks indirectly through the release of pathogens and toxic pollutants into the environment. The disposal of untreated healthcare waste in landfills can lead to the contamination of drinking, surface, and groundwaters if those landfills are not properly constructed. The treatment of healthcare waste with chemical disinfectants can result in the release of chemical substances into the environment if the substances are not handled, stored, and disposed in an environmentally sound manner. Incineration of waste has been widely practiced, but inadequate incineration or the incineration of unsuitable materials results in the release of pollutants into the air and in the generation of ash residue. Incinerated materials containing or treated with chlorine can generate dioxins and furans, which are human carcinogens and have been associated with a range of adverse health effects. Incineration of heavy metals or materials with high metal content, in particular lead, mercury, and cadmium, can lead to the spread of toxic metals in the environment. Only modern incinerators operating at 850 to 1100 degrees Celsius and fitted with special gas cleaning equipment are able to comply with the international emission standards for dioxins and furans. Alternatives to incineration, such as autoclaving, microwaving, steam treatment, integrated with internal mixing, which minimize the formation and release of chemicals or hazardous emissions, should be given consideration in settings where there are sufficient resources to operate and maintain such systems and dispose of the treated waste. Some of the reasons for failure of this healthcare waste management are lack of awareness about the health hazards related to healthcare waste, inadequate training in proper waste management, absence of waste management and disposal systems, insufficient financial and human resources, and the low priority given to the topic are the most common problems connected with healthcare waste. Many countries either do not have appropriate regulations or do not enforce them. The key elements in improving healthcare waste management are promoting practices that reduce the volume of waste generated and ensure proposed waste segregation, developing strategies and systems along with strong oversight and regulation to incrementally improve waste segregation, destruction, and disposal practices with the ultimate aim of meeting national and international standards where feasible favoring the safe and environmentally sound treatment of hazardous healthcare waste. Example by autoclaving, microwaving, steam treatment, integrated with internal mixing and chemical treatment over medical waste incineration. Building a comprehensive system addressing responsibilities, resource allocation, handling and disposing. This is a long-term process sustained by gradual improvements. Raising awareness of the risks related to healthcare waste and of safe practices and selecting safe and environmentally friendly management options to protect people from hazardous when collecting, handling, storing, transporting, treating or disposal of waste can improve healthcare waste management. Thank you.